So, what is the meaning of meaningful use? Meaningful use refers to a set of standards defined by the Center for Medicine and Medicaid Services, which is also known as CMS. Incentives program for the use of electronic health record, which is EHRs. It is eligible professional for hospital must demonstrate meaningful use of certified EHR technology to receive incentive payments. There are three main components of EMR, which is use of certified EHR technology, demonstrations of meaningful use of EHRs, reporting of clinical quality measures. So there are four stages of meaningful use, that is data capture and sharing. For example, in 2011 and 2012, you are data capturing and you are just sharing it. Advanced clinical processes, improved outcome, and information exchange and interoperability. It aims to enhance patient care and improve population health, and increase efficiency. HIPAA compliances is known as Health Insurance Probability and Accountability Act, which compliances refers to the adhere to all the regulations and standards set forth by HIPAA to protect the privacy and security of individuals, medical record, and personal health information, which is PHI. There are some key aspects of HIPAA compliances are, which is privacy rule. It known as it protects PHI and set limits on its use and disclosure. Their security rule is established national standards for protecting electronic PHI, which is EPHI means. The breach notification rules requires reporting of PHI breaches. Omnibus final rule, which known as strengths, privacy, and security protection. Business associates agreements. It means contract with the vendors and partners to ensure PHI protection. So in HIPAA compliances, what are the requirements in it wants? So the requirements wants the risk analysis, identify and mitigating potential risk, privacy and security policies, which is implementing policy and procedures, training and educating workforce members, incident response plan, having a plan in a place for breaches, annual review and update, regularly reviewing and updating policies and procedures. HIPAA compliance is essential for healthcare organization, health plans, and business associates to ensure the confidentiality, integrity, and availability of PHI. So, what is interoperability? Interoperability is healthcare refers to the ability of different healthcare system, electronic health records means EHR, and healthcare provides to share patient data, coordinated care, exchange information, use common standards, and enable seamless communication. So here there are some types of interoperability. First is technical interoperability, means ability of system to exchange data through common standards and protocol. Semantic interoperability means of system to interpret and understand shared data. Function interoperability means which ability of system to use shared data to support patient care. There are some benefits of interoperability means improve patient care, enhance coordinations, reduce errors, increase efficiency, better population health management. What are the challenges the interoperability has to face? Which is data privacy and security concerns, lack of common standards, complexities of healthcare data, cost and resources constraints, competitive barriers, Interoperability is the essential for achieving seamlessness communication, which is coordinated and clear, and improve patient outcome in the welfare or healthcare. So, what is EHR? What is EHR? So, EHR is the electronic health record. In technical jargons, EHR is used for the HL7, and HL7 is means health level 7, which is a standard for exchanging EHR data between systems. FHI means fast healthcare interoperability resources, which is API based standards for sharing EHR data. IHE, which is integrating the healthcare for sharing EHR data across healthcare system. CDA, which is clinical document architecture. It is for standard for structuring EHR documents. CCD, which is continuity of care document, which is a standard for sharing patient summaries and etc. EHR module is the software component for managing specific aspects of patient care, which is medications management, etc. There is a lot of EHR module over there. HIE, what is HIE? Health Information Exchange. It is used for the network for sharing EHR data between the providers. What is PHR? PHR is the personal health record, which is patient controlled EHR. EHR system, software application for managing EHR data, interoperability of different EHR systems to share data seamlessly. Data governance, the policies and the procedures for managing EHR data. It is also a help in clinical decision support, which is CDS, EHR feature providing real-time guidance for healthcare decisions. So you have to order entity management system, which is OEMS EHR modules for managing orders and results. EHR workflow, which is automatic processes for managing patient care. See, these technical jargons are used by healthcare professions, IT specialists, and vendors to discuss and implement EHR system, ensuring efficient and standards electronic health and data management. So, what is patient portal? What is patient portal? A patient portal is a secure online platform that allows patients to access their medical information, communicate with healthcare providers, and manage their care. Patient portals are also known as patient engagement portals or personal health records, which is PHRs. Here are some common features of patient portals, which is secure login. Patient access their portal with a username and password. Medical history, which is viewable records of medicators, test or results and diagnosis. Appointment scheduling, which is ability to schedule or request appointments. Messaging, secure communication with the healthcare providers. Bill pay, online payment of medical bills. Health tracking, ability to track vital signs, allergies, and medications. Education resources, access to health information and educational material. Medication management, refill requests and medication reminders. Test results means wearable able to lab and imagining test or results. Personalized health information, which is tailored health advice and reminders. So, patient portal enhance patient engagement, empowerment, and health outcome by improving access to care, enhancing patient-provider communication, increasing patient education and awareness, streamlining administrative tasks, boosting patient satisfaction. By providing patients with a user-friendly and secure platform, patient portals promote active participation in healthcare management, leading to better health and outcomes and more efficient care delivery. What is the meaning of DCDS, clinical decision support? See, clinical decision support is refers to use of technology to provide healthcare professionals with clinical guidance and recommendations at the point of care. CDS system analyze patient data and medical knowledge to provide diagnosis suggestions, recommended treatments and medications, identify potential drug interactions, offer disease management guidance, support clinical decisions making. So there are some tools including in CDS, which is computerized physician order entity. It is also known as CPOE. Next is clinical decision support system, which is CDSS. Electronic health record, which is EHRs. Telemedicine platform, mobile health apps. The benefits of CDs are improved patient safety, enhance quality of care, reduce medical errors, increase efficiency, and better patient outcome. CDS can be knowledge based using established medical knowledge, machine learning based using artificial intelligence and data analysis. Hybrid means combining knowledge based on the machine learning approaches. So, what are the effectives of CDS integration requires? Seamless EHR integrations is user-friendly interfaces. Regular update and maintenance is must in for getting effective CDS integrations. Clinical validations and testing, continuous evaluations and improvement. What is health information exchange? See, health information exchange is the sharing of patient health information electronically between healthcare providers, organizations, system, and it enables to improve care coordination, enhance patient safety, better informed care, decisions, reduce healthcare costs, support for value-based care. So HIE types are, which is direct exchange, point-to-point sharing between known parties, query-based exchange, which is searching for patient data across network, and next is consumer mediated exchange, which is patient-controlled sharing. So here I have some benefits of HIE is it is reduced duplicating testing, it improved patient outcomes, it enhanced population health management, it increased efficiency and better patient engagement. What are the some challenges faced by HIE? Data privacy security concern, interoperability issues, cost and resources constraints, and variability in data quality needs for standardized policies and procedures. So HIE is a crucial for effective healthcare coordinations, patient-centered care, and improved health outcomes. It facilitates the exchange of patient data between healthcare providers, insurers, and the patient themselves, which promoting collaborative care and informed decision making. So these are the EHR is used for. Now come to ICU. See, in ICU have multiple technical jargons which we used to learn in this video. So ICU stands for Intensive Care Unit. So it is a specialized department in a hospital that provide close and constant care to critically ill patients and who require life-saving treatments and continuous monitoring. ICU patients often require medical ventilations, cardiovascular support, closing monitoring of vital signs, organs, functions, frequently lab tests, and imaging studies. Pain management and these seditions, nutritional support, which is example tube feeding, advanced life support interventions, which is CPR and deliberations. So there are types of CPUs, ICUs are medical ICU, which is MICU, surgical ICU, which is SICU, cardiovascular ICU, which is CVICU, neurological ICU, which is neuro ICU, pediatric ICU, which is PICU. Neonatal means ICU, and which means NICU. So ICU terms typically consist of intubators, which is critical care physicians, registered nurse, which is RNs, a respiratory therapist, which is RTs, pharmacist, physical therapist, which is PTs, occupational therapist, which is OTs, and dietitians. So the ICU provides intensive care to patients with the life-threatening conditions such as severe injuries, for example, trauma and burns, organ failures like kidney, liver, respiratory failure, which is cardiac arrest, or neurological emergencies like a stroke and seizures, infections, sepsis, and pneumonia, or post-operative care, which is major after major surgery. So there are some terms regarding which is related to ICU is first is mechanical ventilation. So what is mechanical ventilation? See, mechanical ventilation is a life support treatment that uses a mechanical ventilator to assist or replace spontaneous breathing. It is used in critically ill patients who require support for respiratory failure, surgery, or other conditions that impair lungs function. There are some types of mechanical ventilations, which is intensive mechanical ventilation, which is also known as IMVs, uses an endotracheal tube to deliver breath delivered to the lungs. Next is non-intensive mechanical ventilation, which is NIMS. It is a use of mask or nasal interface to deliver breath without inserting a tube into a airway. Positive pressure ventilations means deliver breath with positive pressure and helping to expand the lungs. Negative pressure ventilation is NPV, which is delivered to breath and with negative pressure and creating a vacuum to expand the lungs. Mode of mechanical ventilations. So there are a lot of modes of mechanical ventilations, but we will go a little bit. So first is volume controlled ventilation, which is also known as VCV. It delivers a set of volume of air with each breath. Next is pressure controlled ventilation. It means PCV, which delivers breath with a set pressure limit. Next is assist controlled ventilation, which is also known as ACV. It allows patient to trigger breath with the ventilation providing support. Synchronized intermittent mandatory ventilation, it is also known as SIMV, combines with mandatory breath with spontaneous breathing. So mechanical ventilations have different settings regarding first is tidal volume, which is VT, respiratory rate, which is RR, inspiratory pressure, which is IP, positive end expiratory pressure, which is PEEP, fraction of inspired oxygen, which is FiO2. So when mechanical ventilation is a vital treatment for patients with respiratory failure, and its appropriate use requires carefully monitoring and adjustments of settings to ensure optimal lungs protection and having a patient comfort. Next is hemodynamic monitoring. See, in technical jargons, hemodynamic monitoring is the measurement of the observation of cardiovascular system functions, and particularly in critical ill patient, it involves tracking various parameters to assess cardiac functions, blood flow, and blood pressure. So commonly monitoring hemodynamic parameters are blood pressure, heart rate, cardiac output, stroke volume, systematic vascular resistance, pulmonary artery pressure, central venous pressure, mixed venous oxygen saturation. So these all are including in hemodynamic parameters. Incisive and non-incisive method are used for the hemodynamic monitoring, which includes arterial catheters, pulmonary artery catheters, central venous catheters, non-invasive cardiac output monitoring, which is echocardiography or bioresistance, blood pressure monitoring, invasive and non-invasive, which is hemodynamic monitoring is essential in critical care settings such as intensive care unit, which is ICUs, to assess cardiovascular function, guide fluid and vasopressure management, monitor drug effectiveness, detect early signs of hemodynamic instability, optimize cardiac function and perfusions. So, by closing monitoring hemodynamic parameters, healthcare profession can make informed decisions to improve patient outcomes in critical care situations. What is vasopressors? See, vasopressors are a class of drugs that helps increasing blood pressure by including vasoconstrictions. With having the difficult names, you are not able to pronunciate in easy language. But yeah, you can just understand there are some vasoconstricts between them, like endogenum secans, Resvir, Dobatex, Vesicles, Mordia, and many more. There are many more vasculars, a class of drugs which we use in medical terms. So, vascular pressures are used to treat a range of conditions, including shock or septic shock, and are often used in the conjunction and intratrops. Please consult a healthcare professional for prescription and treatment related to the vascular pressures. So these are the technicals, jargons which we use in all the salt language or any type of conditions, any type of medical terms which we use in all these sections are come into technical jargons. So what is HIPAA? What is HIPAA? HIPAA is the Health Insurance Probability and Accountability Act. This is a federal law that set national standards for privacy and security of protected health information, which is PHI. Electronic healthcare transaction and code sets healthcare fraud and abuse preventions, healthcare insurance probability and accountability. So HIPAA aims to protect individual medical records and personal health information. It also improves access to healthcare by allowing individuals to take their health insurance with them when changing job and providers. Establish standards for electronic healthcare transactions such as claims and billing. Compact healthcare fraud and abuse. See, are some key points of HIPAA, which is privacy rule, set a standard for protecting PHI, security rule, which is established security standard for electronic PHI, breach notification rule, which is required for notification of PHI breaches, omnibus final rule, which is strength privacy and security protections, enforcement rule, which is established penalties for non-compliances. So why HIPA applies to covered entities, which is CEs, means healthcare providers, plans, and cleaning houses. Business associates, which is also known as BAs, which is vendor, contractors, and subcontractor that handles PHI. So HIPAA is a violations can help in results in fines, penalties, and legal actions. Compliances is essential for protecting patient privacy and avoiding legal and financial consequences. Protected health information. See, what is protected health information? Protected health information is individually identifiable health information, which includes demographic data, medical history and conditions, test results and treatment plans, insurance information and billing records, health insurance numbers and identification numbers, biometric data, which is fingerprints and facial recognitions, genetics informations, mental health and substance abuse treatment records, and many more. So PHI is a protected under the Health Insurance Portability and Accountability Act and the privacy rules, which sets national standards for privacy and the security of PHI. So patient rights also assess the amendments, accounting of disclosures, permitted use and disclosures, which is treatment payment, healthcare operations. Covered entities, healthcare providers, insurance companies, and business associates, examples, vendor contractors, must comply with HIPAA regulation to ensure the confidentiality and integrity and availability of PHI. So examples of PHI is medical records, hospital bills, insurance card, prescription labels, lab results, medical images, for example, X-rays, MRI, CT scan. So non-PHI example is de-identified health data, which is X-rated statistics, publicly available information, which is name in a phone book, health information from non-covered entities, which is fitness trackers, wellness apps. So PHI is a critical component of healthcare, and its protections is essential for maintaining patient trust and confidentiality. So breach notification is a process of informing individuals, regulatory bodies, and other relevant parties about a security incident and data breach as required by law or regulation. Purpose of breach notification. Transparency and accountability is most needed. Prompt notification to affect parties. Mitigations of potential harm. Compliances with legal and regulatory requirements. There's some key elements of breach notifications are identification of the breach and affected data, investigation and contaminated of the breach, determination of the scope and severity of the breach, notification to affected individual, regulatory bodies, HIPAA, which I told you earlier, JDPR, law enforcement, which is required, credit reporting agency, it also required, if required, so it could be the credit reporting agencies. So provisions of support and resources, which is credit monitoring, compliances with applicable law and regulations, which is HIPAA, GDPR, state laws. So timing of breach notification is as soon as possible and no later than 60 days, which is HIPAA, and in 72 hours, which is GDPR. So it varies by state to state. For example, if you are in California, if there are 15 days, you are just required. So what are the consequences to failure to notify? There is legal and regulatory penalties, reputations damaged, loss of trust in business, potential for further harm to affected individuals. Breach notification is a critical step in responding to security incident and demonstrating accountability and transparency. Business Associate Agreement. So what is Business Associate Agreement? It is also known as BAA. Is a contract between a covered entity, for example, healthcare provider, insurance company, and a business associates. For example, vendor and the contractor, that outlines the terms and the conditions for protecting sensitive information such as protected health information. The BAA ensures that the business associates and implements appropriate administrative, technical, and physical safeguard to protect PHI. Only use in the discloses PHI as the permitted by the agreement and the applicable laws. What are the reports and the breaches or security incident to covered all the entities? Compliances with HIPAA regulations with other applicable law. The BAA is a required document under the Health Insurance Probability and Accountability Act, which is HIPAA, to ensure that the business associate handles PHI responsibly and maintain its confidentiality, integrity, and the availability. So key points of a BAA, it is a definition of PHI and a scope of work which is permitted due to all the disclosures. Safeguard and security measures which breach notifications and reporting. compliances with the HIPAA and the applications law, the terms and terminations provisions required, dispute resolutions and the liability. By signing a BAA, business associated acknowledge their responsibility to protect sensitive information and agree to comply with the required standards and regulations. So, at last, I just want to conclude that you have reached the conclusion of our journey through the technical jargons. We have explored various terms and concepts related to business, finance, technology. So, for example, internal rate of return, which is IRR, customer acquisition cost, which is CAC, churn rate, customer lifetime value, CLV, supply chain management, procurement, vendor machines, customer segmentations, conversion rate, customer retentions, and all the medical terms which is we use in ICUs. So these terms are essential for understanding mechanisms of business and technology, and I'm glad that we could break them down together. So if you have any more terms you have like to explore or needs for the clarification of any of these, so feel free to ask. Otherwise, good. Thank you so much.